Hi, I'm Michael Palmer with 45 Urgent Care with your tip of the week. I thought this week would be we're at this time of the season that I thought it would be a good time to start talking about influenza, or most commonly, as you know it, as the common flu. Now, the flu is a respiratory virus that tends to affect the nose, throat, and lower respiratory tract. Now, symptoms that normally come along with the flu are headache, body ache, chills, fever, cough, runny nose, and just generally feeling terrible. Now, some people also get vomiting as well as diarrhea that comes along with the flu. Now, flu is transmitted by droplets that come from our respiratory tract. Now, usually from coughing or sneezing, these droplets are put out in the air, and people that come in contact with this have the capabilities of developing the flu. Now, people that are more susceptible to flu are younger children as well as older adults and patients that are in their immune system has become a little bit weakened. This allows the virus to take hold and start developing these symptoms. Now, on the treatment side of it, I have brought a couple of things here today to kind of talk about. One, we're going to talk about what does no good. Now, I've got here in one hand different types of antibiotics. Got one, amoxicillin, won't touch anything for the virus. I've got another one, azithromycin, won't do anything for it. Now, the flu is caused by a virus. The virus does not respond at all to any antibiotics. The only treatment that we have as far as catching, if we can catch it early enough, usually within the first 2 days of symptoms starting, we can use antiviral therapies which tend to shorten the course of the flu, and at least has been shown to shorten it at least by 2 days to help bring down. Other things we'll do is treating the symptoms as far as helping with the cough, congestion, with symptomatic medications that tend to help. Now, people often ask me, am I contagious to other people with this? Now, once you develop symptoms, usually you are contagious for around 5 days after these symptoms started. Now, you can be contagious at the very beginning before symptoms, usually a day before, but usually symptoms and the contagious of the virus will tend to linger on for 5 days after these symptoms progress. Now, how can we stop? What's our best thing that we can do prophylactically stopping us from catching influenza? The best thing I highly suggest for everyone is to get your flu vaccine. Flu vaccine has been shown time after time to be able to cut down on the number of cases that we see of flu each year. So I highly suggest everyone getting that. Now, if you come down these symptoms, I suggest you get in with your primary care provider. We have testing that can be done to see if it is the flu going on and get you started on the right course to prevent this from progressing to more serious respiratory illness. Now, I'm Michael Palmer with 45 Urgent Care with your tip of the week.